Hello and welcome back to OET Speaking Unlocked by Kirti Institute. The last episode we discussed on FAE formula for information gathering, and I'm pretty sure that you are able to apply this formula into your respected task. And if you have practiced with your, partner for speaking, I'm sure that you are able to apply it and ask the questions confidently. Now, in today's lesson, we are going to discuss on information giving. And as a healthcare professional, you always share the information, right? So here I have created two formulas. Number one is shares, and number two is GPS technique. So are you excited to learn? Let's begin. Now, generally, information giving is taken as providing information, and providing information means one speaker speaks, right? As a healthcare professional, you provide the information, but make sure that it does not become monologue. Okay, it should be interactive. You are communicating with your patient, so it should not be one way, it should be two-way communication. And when you provide the information, you also need to be an active listener. Okay, the responses you gather from the patient should be heard. Patient should feel that okay, they are understood, they are heard, and there is a healthcare professional who is able to understand them and who is ready to find the solutions for them. Okay, so this builds the rapport with your patient. Now, let's talk about shares formula, in which S sounds for start with what the patient knows. Now, before we provide the information, we need to understand that what patient believes about this, what patient knows about particular things. For example, suppose you have explained what is diabetes. Okay, you are saying that there are two types of diabetes, type 1 and type 2. In type 1 diabetes, insulin is not produced, whereas in type 2 diabetes, the insulin is produced, however, it's not sufficient or it's ineffective. So, are you clear about diabetes now? And the patient says that, yes, I know about two types of diabetes because my mother has type 2 diabetes and I have researched a lot on it. So, this is your total wastage of time, right? Instead, before providing the information, we should always ask that, what do you know about diabetes? Okay, so we are trying to understand what is patient's understanding about the diabetes. The patient might say that I know it as a sugar diabetes. Okay, the sugar increases in the blood. Now you're explaining that, okay, you're absolutely right. The blood glucose level, that is sugar, increases in blood. However, let me explain a bit in detail. And then you are explaining both the types of diabetes. Okay, so first understand what the patient already knows. Now, H in shares formula is hand over information in chunk. Now, imagine that you are providing all the information together. What will happen? The patient will be overwhelmed. Suppose you are talking with a newly diagnosed diabetic patient and suddenly you started informing to the patient that now from tomorrow onwards you will need to start taking the medications, you will need to make lifestyle modifications, like you will need to do exercises for half an hour daily, and in your diet you will need to stop having the dairy products, okay, packaged food, and you should start having the more fiber rich diet, and so and so and so and so. The patient will feel that, oh my God, there are a lot of things to do. My life is going to be upside down, right? We don't want our patient to feel in that way. We may simply say that there are three main things you need to work on. The patient will say that, okay, go on. Number one is medication. As your blood sugar level is not under control, the doctor has prescribed you some medications and you will need to start taking it daily. Number two is diet. In diet, you should consume more fiber in your daily diet and you should try to avoid having dairy products. And the last but not least, you should start doing exercises. Now, you may just begin by walking for 5 to 10 minutes, and then gradually you can increase time or distance. What do you think about making certain lifestyle changes? Do you think you will be able to follow these instructions? See, so we are providing one part of information that is called chunking, and then we check whether the patient understands or not. And that is E, evaluate, understand. So provide a chunk of information and then check. Now, generally, what happens in OET tasks, under one bullet point, you may have two, three information. It might be about on one single topic, it might be two different topics. Okay, but you need to see that where you need to take a pause. When one topic ends, you should ask, are you clear? So I always say that consider each and every sentence as a different task. And then you think that whether you want to continue or you need to have a break. Okay, so checking and chunking. Provide small information. Check that patient understands or patient is willing to follow your instructions, and then you move on. Okay, so that is about H and E. Okay, hand over information in chunk and evaluate the patient's understanding or willingness to follow. Okay, then A for acknowledge feelings and cues. Now, see, the patient always shares the feelings in direct or indirect way. The patient may not say directly that I'm really concerned, but patient might give you the cues. Oh my God, diabetes to me. I don't eat blood sugars. Okay, sorry, I don't eat sugars, and even nobody in my family has diabetes. Now, with these concerns, you can understand that patient is concerned. Patient is worried about the diagnosis. So first approach that concern and then you can provide more information. So the chain has to be followed, you know. You are asking the question or you are providing the information, then you are checking, okay, that whether patient understands or not. And when the patient responds, you approach to that, that response first and then move on. So you need to build the next communication based on what patient has responded. Okay, so patient might be shocked, like as a doctor you have just diagnosed the patient with cancer. Okay, so allow the patient to ventilate the feelings, acknowledge that feelings, and then you can. Okay, so catch certain cues or understand whenever patient shows any type of negative feelings, approach that, whether it is written in your task or not. Empathize with the patient. Whether it's written or not, you will have to empathize. You will need to understand your patient, understand the feelings, and then you can move on. All right. The next is R. R, relayed information to patient's eyes. Now, what is eyes here? Okay, relayed information to patient's eyes. Eyes is ideas, concerns, and expectations. Okay, so suppose patient says that, oh my God, I have diabetes. So connect with that. Okay, I can completely understand that the diagnosis has come as a shock to you. However, the investigations indicates that you have type 2 diabetes. Okay, so relate your conversation with what the patient says. Also try to understand what patient expects before you give the information. So suppose patient has come in with the headache, okay, bad headache, and patient says that I'm having too much headache, I cannot tolerate it. Okay, and you have ordered an MRI and you found out something. Okay. But before you explain your findings, you need to ask what patient might be thinking about this headache. As a patient, what do you think? Okay, what the patient might be thinking. Patient might be thinking that, okay, because I didn't sleep last night, because I was under stress, my workload has increased, or worse to worse, the patient can think that it might be migraine. Okay, but your MRI scan indicates that the patient has brain tumor. Now you think that before understanding the patient's expectations, if you are directly providing the diagnosis of brain tumor, what will happen? Before something happens with the brain tumor, you will give heart attack. Okay? So don't do that. You try to understand what the patient thinks, what the patient believes, what is their perspectives. Okay? And then you provide the information. Okay, and the last letter S is seek further information needs. So you need to understand, you need to ask if the patient needs any more information. Okay, so you ask, do you have any other concerns? Apart from this management, do you have any other concerns? Would you like to know more about anything else? Okay, so you may ask the questions in this way. So I'm sure that this shares formula this side, okay, operation theater this side, okay, general ward this side. So that is signposting. And in our communication as well, we signpost, we help the listener to understand what we are about to talk. Okay, so you may say simply that we have discussed on exercises. Now let's talk about your job. What kind of job do you do? Okay, so I meant to say that you completely cover one topic and then move to another. Don't rush to complete your tasks. There is no criterion like task fulfillment in OET. It is not mandatory that you cover all the given tasks. So don't rush. Try to finish that particular topic and then move on. slowly and gradually to another topic. Okay, we have discussed on exercise program. So are you clear about the program? Do you think you will be able to follow this program? Yes. Okay. So now we have discussed about exercises. Let's talk about your job. What kind of work do you do? Okay. So this is how you can move to the another topic. Now, P stands for